Hi, good morning. My name is Laika, and I'm going to do the skills one, which is the oral sectioning. So Mr. Smith here has a pneumonia, and she needs to do the oral sectioning. I'm just going to set up by doing hand wash. I'm just going to set up first the wall section. Just check if it's working well. And I'm going to do hand washing. And then I'm going to put on my gloves. Then connect this to the wall. Hello. And I already positioned my patient to high forwards position. And the rate of the wall suction is 80 to 120, but I put it in the 100. So I'm just gonna treat in here. And then there's a solution oral just to clear the young clip. And then I'm gonna instruct my patient to open her mouth. I'll do a suction. So Mr. Smith, I will start suctioning because you have an excessive secretion. Just open your mouth. Okay. There, I'm gonna go to the side. Just make sure all the secretion gonna be suctioned. Open and then I'm gonna do it again one more time. Just put this one. If you could, before the next thing of suctioning, if you could like cut out or deep breathing first, then I'm gonna do it again. And then if everything is clear already, I'm done with the oral suctioning, and then I'm gonna proceed to the next skills.
Okay, hi, my name is Nicole Broomfield. I'm going to be the student nurse today, administering medication. I'm going to do hand hygiene. I'm going to don gloves. So Mr. Smith is requiring insulin because of shortness of breath. So I have, not insulin, Ventolin because of shortness of breath. So I have the insulin puff here, and I'm going to confirm the details with the order, right name, right dosage, right route, the 10 requirements of medication administration. So we're confirming that he's going to receive, or she's going to receive, or he's going to receive 2 puffs per mouth. Okay, so I have the Ventolin, the name is there. I'm going to confirm the 2 identification for the patient, name and date of birth. I'm going to advise the patient to be sitting in a rise position, and then I'm going to also advise the patient, so after I put it to the chamber, I'm going to advise the patient to put his lips tightly around the opening of the chamber, and then I'm going to ask him to clamp the lips. I'm going to administer 1 puff at a time. Between each puff, I'm going to tell the patient to hold his breath, inhale, wait 30 to 60 seconds, administer the second puff, while his mouth is advised, reminding the patient to have his lips tightly around the seal to create a tight seal, and then remove the chamber after the puffs have been administered.
Okay, so the patient is going to be receiving his insulin injection. So I'm just going to be explaining to the patient. So Mr. Smith, I'm just going to be giving you your 10 units of insulin that you get 3 times a day. Is there anywhere preferably that you'd like to inject it? Okay, perfect. In the abdomen. So I've already drawn up 10 units. Okay. I'm just going to be checking their name, his name and his date of birth, and of course checking the right dose, right time, right order, right place, and right site. Okay, I'm going to be doing hand hygiene, putting on my gloves.
Five minutes to go.
Okay, alcohol swab.
Okay, hi, my name is Fars, and I'll be doing oral sectioning.
Making sure to clean the site for 15 seconds.
Oral sectioning, I'm going to raise the head with the patient and follow the patient.
And just going to come this way. I'm just gonna be also, right before injecting, I'm gonna be pinching the skin. So again, this is the 10 units. 90-degree angle. There.
And I'll leave the facing to,
Hold for about 10 seconds.
and then I'm going to put the sachet from 80 to 85.
And removing.
80 to
And that's all.
intermittent.
I'm gonna be
4 seconds.
cleaning the site one more time.
I'm going to clean
And that's all.
from the left.
Hi, my name is Laika. I'm gonna do the oral sectioning for Mr. Smith who has a pneumonia. So I'm gonna do hand wash agent first. Then I'm gonna set up a wall section here. Before that, I have to connect the yunker just to make sure that I got the right pressure. So it's around 80 to 120. I'm just gonna set it into 100. Then there's a solution in here. This one, and then clear. Set this up. Now I'm gonna do my gloves. And then I'll just gonna start sectioning. Can you please open your mouth, Mr. Smith? I'll go each side of the mouth, under the tongue as well. Okay, then rinse out, and then it's gonna encourage him to do coughing. So can you cough? And there you go. I'll do suction again. Until all the secretion gonna be removed and there's no more excess secretion presence in the mouth. And that's done for the oral sectioning.
Hi, my name is Nicole. I'm going to be the student nurse today. I'm going to be administering medication to Mr. Smith due to his shortness of breath. So I'm going to look at the order. I'm going to wash my hands, don gloves, look at my order, and ensure that I have the right name, the 10 rights of medication to make sure it's the right dose, right name, right purse. I've verified it's the Ventolin. I've inserted into the chamber. I'm going to advise the patient to clench down with his lips to create a tight seal. I'm going to apply the first puff. In between each puff, I'm going to let the patient know to keep a tight seal, inhale, and breathe through his mouth. And then I'm going to do another puff after 30 to 60 seconds, and then apply another puff. And repeat again, tight seal, and also inhale through the mouth. Once completed, keep the patient in upright position and document the medication administration.
Okay, and now I'm going to be administering Mr. Smith's scheduled insulin 3 times a day. So Mr. Smith, I'm just going to be checking your first name and your date of birth, first name, last name, date of birth. I'm going to be checking it's the right dose, right time, right route, all the routes. So I'm going to be injecting 10 units of insulin. I'm going to be starting with hand hygiene and putting on my gloves. And this is going to be inserted into the abdomen. Subcute injection. I'm going to be cleaning the site. 15 seconds. Okay. 10 units. I'm going to be pinching. Inject. Hold for 10 seconds. Remove. And then dispose of the needle into the sharps bin.